Makakausap natin ngayon si OCTA Research Fellow Ranjit. Sir, magandang gabi po sa inyo.
Magandang gabi sa inyo at sa lahat na nanonood po sa atin.
So, should we still wear our mask indoors or is it really safe?
Well, I think it's very clear, our health officials are very clear that we should wear our masks indoors and continue to practice minimum public health standards. The government has decided, I hope, based on science and the best advice and consultation with our health experts, that this is a timely and appropriate change in policy. Our hope in OCTA is that whatever policy change, because it's now moot and academic, the president has decided and the government has decided, that it will not increase infections. The fact of the matter is, this is not the best time to do it. No, there is a time and a context for changing policy. And I agree with my friend Tony Leachon that there are certain criteria that should have been set before we made this very very important policy shift. I can understand the lifting of mandates outdoors, but indoors, I think it's a risk, And we don't know if the best science was utilized in crafting this new policy direction. We also don't see the link between this and improving tourism. Tourists will come to the country if they know infections are low. So the best way to attract tourists, make sure the infections are low. And that's why we need to continue with vaccination, with the practice of minimum public health standards, with wearing masks, as now it's going to be voluntary. We have new variants coming in. We also understand, that this is part of the government's move to change the COVID mindset. But the OCTA has done a survey in the first quarter. It's very clear, nearly 50% of citizens will continue to wear masks even if mandates are lifted. So, there's nothing wrong with wearing the mask. Actually, many Filipinos are comfortable with it, about more than 50%, Some will wear it for a whole year, even if COVID is not there anymore, because people see the value of protecting themselves, especially indoors.
You brought up many points, sir. Let's begin with yung sinabi po niyo, tourists will come to the country if infections are low. So, hindi yung tourists will come to the country kung hindi sila kailangang magsuot ng mask.
Yeah, that's number one. I mean, that's you don't need to be a rocket scientist to understand that, people go to a place because they feel secure in that place. People go to to a certain tourist destination because it's easy. The travel restrictions are not so draconian and cumbersome, So pupunta ang turista pag madaling makapasok sa bansa. So maybe that should have been the adjustment made. But then again, this is where the government is going, and this was an issue that will eventually would have been discussed, eventually, because lifting of masks indoors was a big discussion as early as the start of the year. But the reality is we've had so many surges, and there's no unanimity as far as the health experts in our country are concerned. Many are against the idea. So, but then again, now we're here, so we move from the mandate to personal responsibility. It's up to us to decide the risk, and up to us to protect ourselves, by wearing the mask, by considering the boosters, by encouraging others to vaccinate also.
So para bang assessment of your personal risk appetite. Kung malakas ang loob mo at feeling mo healthy ka at wala kang problema magpumunta ng isang shopping mall, hindi mag-mask, nasa sa inyo na yon. Ganun ang mangyayari, sir, But let's talk about yung indoors and why is it so important indoors. Pag-usapan po natin, sir, can we try and explain in very layman's terms the importance of airflow, good ventilation in a closed building. Halimbawa, a big shopping mall as we're showing right now. Of course, air-conditioned, karamihan sa kanila air-conditioned. That means the risks are a little bit higher in a place like that.
Well, I think it's always high, in enclosed areas. especially that given the fact that our vaccines are still, we're in the process of getting the bivalent vaccine, the vaccine that's really made for this very contagious strain, Omicron, no? So while we don't have that, it will really be a risk to take off your mask indoors, no? Especially given the fact that in many private sector and establishments, the masks has not, the ventilation, the retrofitting is still in the they're still in the process of improving ventilation and protocols inside their workplaces. It would be, a challenge talaga. That's why the abruptness in the policy change is something that I think, is something that I'm observing as problematic. No, maybe we should have done this gradually, given time for people to make adjustments. No, because it has impact on productivity if your workforce is sick. So especially now that we have these very contagious variants spreading all over the country, as you notice, properly reported by OCTA, the infections have moved to the provinces already. We hope that the worst is over, no? But in many provinces, we're still experiencing a surge, no? In Tarlac, 50% positivity rate, no? So it shows, no, na COVID is still here. It's a threat to all of us, and we should be mindful of this threat.
And we're going to have to wait for a few weeks, hindi po ba, sir, about 2 to 3 weeks before we can see the effect on the numbers. Are they going to spiral upwards, or are we going to maintain them at this level, or will they go down? At the same time, sir, I want to ask, because the announcement was made by DOT Secretary Cristina Frasco and not by Health Department OIC Maria Rosario Vergere or any of the other assistant secretaries. What does this mean to you? Let's talk very quickly about, the politics of health. We just yesterday had that announcement that an undersecretary of DOH has been appointed, former Chief PNP Picoy Cascolan, although no DOH secretary yet.
Yeah, this is a ticklish issue, and I think the government has taken, the president has taken a position on it already. My sense is we need to resolve it as soon as possible. We should get it's either we hire Dr. Vergere and make her the health secretary, or get someone as soon as possible, because we need a full-time person who can manage the health portfolio and make decisions for all of us as far as the health is concerned, no? And that's why there's a need for us to have a health advocate and champion in the DOH, no? With a permanent position as a secretary. So yun lang ho. Kaya kailangan ho talaga maglaan na tayo ng health secretary ho para sa DOH. It's about time, no? And this issue of COVID will not disappear naman without by just lifting restrictions and trying to say that it doesn't exist anymore. COVID is here, and the best way to win against it is to confront it. No? We are now lifting so many of these restrictions very quickly. We hope that this will not create further infections, no? And we hope that the government policy will be still focused on we're all in this together and not shift to you're on your own. So this is where I think a good health secretary would help calibrate policies and push public health interests and issues with Malacanang. That's why there's a need for us to have a full-time health secretary at this point.
Ang timing nga naman, parating pa naman ang undas, hindi po ba, sir? November 1 and 2. And at the same time, Pasko, December, malapit ng December. OCTA Research Fellow, Sir Ranjit, maraming salamat po for being with us tonight.